Hi, and welcome to the Fall Prevention Education session in Physiotherapy Part 1. A Fall Prevention Education session will be presented by the following disciplines: nursing, occupational therapy, and physiotherapy. The objectives of this program are to increase your knowledge on the risk factors of falling, identify risk in the hospital and at home, develop strategies to reduce the risk of falling, and answer your questions. And the goals are to prevent falls in the future and establish an action plan that is effective for you. But why are we talking so much about falls? Because 85% of injury-related hospitalization are among seniors, and 95% of hip fractures are caused by falls, and also 50% of falls leading to hospitalization occur at home. Falls are also important to talk about because they're the first cause of injury amongst the elderly, and a third of the clients hospitalized for falls are transferred to a long-term care facility when discharged from the hospital. But the good news is that we can prevent and take action to avoid falls. But why do we fall? Certain causes of falling cannot be changed, such as aging, neurological disorders, and vision problems. But other factors can be changed. For example, our physical health, our diet, our medical health, our clothing, the level of risk-taking, our medication, our environment, and the quality of our balance. But why should we watch all 3 sessions on fall therapy? Because each session approaches different subjects on the causes of falling. In nursing, you will talk about medication, urinary incontinence, and blood pressure. In physiotherapy, we will talk about footwear, walking aids, and balance and activity. And in occupational therapy, you will approach hospital and home environment, life habits, risk-taking, and assisted devices you can use. In resume, the physiotherapy session will talk about how to know if you are wearing appropriate shoes, which walking aids you can use, the importance of staying active, the risk of dual tasking, and what to do if you fall. Wearing appropriate shoes. Some slippers can increase the risk of falling. Which of the following shoes do you think are the safest? The answer is the second pair and the 4th pair. Let's see why. Your shoes should have 3 of the following components: be closed at the heel and well adjusted, fasten with laces or Velcro, and have a non-slip sole, because better foot support makes walking safer. Here are additional images of appropriate and comfortable shoes. Let's see which shoes are appropriate on these images. The 3 with the green check mark. True or false? Sandals and open shoes are not safe. The answer is true. Ideally, we want closed shoes, non-slip sole, and shoes with fasteners as Velcro or laces or elastic laces. Now let's talk about walking aids. Here are images of different walking aids. We have the walker, the single cane with a large base, the rollator walker, the walking pole, and the 4-point cane. True or false? Using a walking aid like a walker will decrease my autonomy. The answer is false, just the opposite. It allows you to maintain your autonomy by remaining active and reducing your risk of falls. Just make sure that you use the walking aid that your therapist recommends for you. True or false? It is not necessary to use my walking aid indoors, but only outdoors. The answer can be true or false, because every person in every situation is unique. It is important to listen to our recommendations that are individualized for you.